This video is all about muscle tears and muscle strains and why they happen in the first place and what you can do to avoid them. I'll also discuss overuse injuries of muscles and what you can do about those. And then I'll take a look at the muscle pain you get from tense, tight muscles that you get through stress or working in front of a computer all day. Welcome, my name is Marika, and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury-free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. So, muscle tears, why do we get them? Can we prevent them? If I have to say, yes, there are of course loads of reasons why one can get a muscle tear, but the two most common things that I see in my practice, or three most common things, is one, trauma, so something you have no control over, like for instance falling off your bike, tearing your quad or something like that. And then the other two you actually do have control over. People often report tearing muscles towards the end of a match, or after doing a heavy bout of training, or towards the end of a long run, so basically when they're tired. And then thirdly, it's when they haven't warmed up properly. So if they jump into playing a match quite quickly or jump into training without doing a proper warm-up. And let me explain to you why that causes trouble. So I've actually spoken about warm-up in the past, so you can go look at my blog. There's a whole article about that and why it's important, but I'll give you the highlights of that. So when we warm the body up before exercise, we activate the nervous system. Now, your muscles may be as strong as they can be, and you may have put a lot of training into them, but if the nervous system isn't awake and controlling them properly, you cannot get proper contractions. So I don't know, who of you have ever stepped off a curb or the stairs and misjudged the height? You know how it can jolt you? That's when the brain gets the calculation wrong and it hasn't actually lengthened the muscles and everything properly. And you know how you can actually sometimes sprain yourself or even fall if you do that. So just think about all the calculations the brain has to make when you're just running in a straight line. It's got to decide where to place the foot, how far to lengthen the muscles, how strong to contract the muscles to get up the hill or just to sidestep. So as soon as you put that into a football match, you can imagine how many calculations are going on then. So the nervous system really has to be awake. Now, if it's a bit sluggish and it's not been fully woken up, you can get uncoordinated contractions. So the other thing that's important to say is that a single muscle doesn't just have one nerve that goes into it and supplies it. It actually has loads of nerve endings going into it. So all of these have to work together to get a nice smooth contraction. If that's slightly out of sync, you get an uncoordinated one which can cause a muscle tear. Then the second thing that a warm-up does is it actually improves the consistency of the muscle fibers themselves. It makes them more flexible. So that helps as well. And then the third thing that I'll highlight there is it improves your position sense. So position sense is when you close your eyes, you know exactly where your fingers and your toes and everything is. And your brain basically needs to know where all your limbs and all your body parts are without looking at them. Otherwise, you'd have to walk around looking at everything the whole time. Now, if that is slightly dulled, your brain can't really calculate properly where to put your feet down when you're running or how to do the movements properly. Again, predisposing you to muscle strains and, to be honest, strains of ligaments and things as well. So warming up properly is really important. Then the second type that I mentioned was people who get injured towards the end of a match or towards the end of a long run, or that they've just gone out and they felt tired and then they pulled a muscle. Again, the reason for this is that it's not just the muscles that get tired when you get tired. Your nervous system can actually also get tired, and it comes back to then not controlling it properly and you getting a muscle tear through that. So if the muscle fibers themselves are depleted of all the nutrients that they need to contract and they've been tired out to the point where they can't go anymore, that's when you sustain muscle tears as well. So it's really important that you make sure that you don't push too far into fatigue when you train. Now, top tips is if you're doing a training session, the whole idea is to get tired. but make sure that you schedule your complex movements and like the hard ones like plyometric training towards the beginning of the session, that you don't do those high risk movements towards the end when you're already tired. Also, remember that mental fatigue tires out the nervous system again, and there's good evidence out there to show that when athletes are mentally fatigued, they're actually also more injury prone. And I'll put links to all of that in the blog post that I've written on this subject as well. You can find that link in the comments, or I'll post it in the group later on. Good, so that takes care of acute muscle strains. Basically, when you're tired, mentally fatigued, or when you haven't warmed up properly, you may run into trouble. Now, the second type of muscle injury that's quite common is overuse injuries. So what do I mean by overuse injuries? It means that you have either not given the muscle enough time to recover between exercise bouts, or you have done a lot more than what the muscle could cope with in one single training session. So let's take that second one first. So if you up your training too quickly, the muscle isn't actually strong enough to cope with the load that you're giving it. Now, what do I mean by load? Load can be have a different meaning depending on the sport or activity you do. So for somebody who picks up weights, load will be the kilos that you're picking up. For somebody who runs, load will be the intensity you run at. The terrain could even count. So if you're only used to flat running, if you suddenly do loads of uphill running and high intensity, that may overload the muscle acutely. For people who do exercise classes, if you jump from doing 3 classes a week to 6 classes a week, that's a too sudden increase, and you're likely to tire the muscles out and create an injury that way. But the main culprit when it comes to overuse injuries is actually overloading it just a little bit too much over time and not giving it enough time to recover. When you train, the body first breaks down microtrauma. You need a period to rest to get it to build up again and get stronger. And if you give it enough rest and you train in that period where you've actually compensated for the training, then you will progressively get stronger. If you train in this bottom level where it hasn't fully recovered yet, then your curve will go down and you will eventually get an overuse injury. So it's quite obvious from that recovery is really key. And I must say that a good indication that you're heading for overuse injury is usually if you have persistent muscle tightness that does not want to go away. No matter how much you foam roll it or stretch it, it's just there and it feels as if it's getting worse. That's likely a sign that you actually need to rest it rather than keep on straining it. And to be honest, in those circumstances, stretching and foam rolling usually doesn't make much of a difference. So top tip with regards to overuse injuries, the first one would be to definitely keep a diary of your training. You can't judge what you did wrong if you're not going to know the volume of training you've done and what type of things you've had in that week. Because trust me, often when I ask people what they've done on the weekend, on a Monday, they can't remember what they did on the Saturday. So if you want to stay on top of your niggles and really get to know your body, you have to make a note of the training you do. And it's so easy these days because most of the things download to Garmin or to I have no memory today. What's the other? Can anybody remind me what the one is that everybody Strava? There we go. There we go. Finally got there. Okay, so those two are the main types of muscle injuries you get from training. Now, I'm sure most of you have had stiff necks or achy backs from either sitting in front of the computer for too long or just being in a really stressful situation or commuting plus work, not sleeping enough. What works for that type of muscle tension and pain? So yes, massage and things like dry needling can definitely make a difference into your pain, and I find that my patients get really good relief from that. The only problem is that if you don't take the trigger away, that's quite short-lived, and you'll find that you tighten up again over the course of a week or 2 weeks, depending on how your situation or what your situation is. People often ask me, if they can stretch, or if they like it when they click their necks because they can get relief from that. Yes, actually clicking joints have been shown to decrease pain in the short run, but as you know, you've got to click it every now and again because the pain just comes back. And with regards to stretching, again, it can usually relieve it for a little bit, but then the discomfort comes back. So what can you do about it? The first thing is you definitely need to figure out why it's that tight. So if it is stress, if it is you working for too long hours in the same position, then you've got to change those two things. You've got to make yourself take more breaks, and you've got to do things that actually de-stress you. But I must say that the most effective thing I've found in the past for my patients who struggle with really tight necks, tight backs, and it's muscle spasm not due to injury, it's just muscle spasm due to keeping themselves quite tense during the day, is actually using those muscles and doing things where they increase the blood flow through the muscles. So weight training or swimming, any type of exercise that uses those muscle groups. I will say, word of caution, if you've got a really sensitive neck, going into classes where you do high quick movements with weights and stuff is maybe not the thing to do. You've got to choose the exercise that works for you, and sometimes you have to start with really slow things like controlled weight training on the weight machines could even work. But I would definitely speak to a physiotherapist if you've got a sensitive neck or back and you're a little bit worried about flaring it up, or you have flared it up in the past. Excellent. So that is pretty much everything I wanted to talk about. Now, if we look at some of the questions we got in today, Richard Jenkins had quite a few today. He asked if rice is still the preferred method of treatment for muscle injuries. The question is yes, but we've also actually added a few things onto that. So rice stands for, now I always get this wrong, for rest. So you're resting from aggravating activity. So if you've torn your calf, you don't go run on it. I is for ice. So you place ice on it. Ice is really only effective in the first 3 or 4 days, I would say. If you sustain a muscle strain at this moment, then whacking ice on that for the first 10 minutes or so is really useful because it can stop the bleeding. And if you can limit the bleeding, you actually limit all the secondary damage you get. There's been a lot of hoo-ha about not using ice because it decreases the inflammation. Inflammation is needed for healing. Totally agree with that. But to be honest, you're only using ice for 10 minutes at a time, taking it off for 10 minutes, putting it back on for 10 minutes, and that's it. It's not going to limit the inflammation to the point where you're not going to get proper healing. It will actually just help control the swelling and the extra pressure that the swelling causes, and thereby will actually help the tissue recover. Now, after day, I'm going to say 3, 4, it's not an exact science, you're welcome to start using heat if you wanted to. The reason you don't use heat within those first 3 days is that the injury inside is still quite weak. So you would have torn a few blood vessels and things again, and heat actually increases blood flow. So we don't want the blood flow to increase at that point because then it may cause more bleeding. After day 3, I think you can get away with a bit of heat, but I wouldn't go crazy with that. After a week, you should be absolutely fine to apply heat. And at that point, there's really no research to suggest that either ice or heat is better. It's all about what makes you feel better. On that note, you can actually cause more swelling or bleeding with using ice as well. So you should only be applying it for 10 minutes at a time, taking it back off, putting it back on for 10, and that's it. You can reapply it an hour or so later, but if you leave it on indefinitely, what happens is the blood vessels first constrict, and then after a while, if the brain perceives the skin to be in danger of getting a cold injury, then it actually opens the blood vessels again so that it can heat the skin up. That's why it's important to take it off for those 10 minutes to just get the skin to warm up again, that you don't get that effect. Otherwise, you will actually cause the swelling to be worse. Oh yes, and then we've also added an M to the end of rice, so it's now rice M. And the M stands for gentle movement, because what we've seen through the research is that while it's fine to keep something still for the first few hours or so, actually gently moving it, but not pushing into pain. I'm not talking about, can I stretch this straight? It's literally, if my arm hurts to straighten it to there, I straighten it short of there. So I'm just moving it very gently in a pain-free range. That's actually been shown to help healing. So it's all about being gentle at that point, but not being terrified of moving it. I may change my advice if it's a bad strain. If it's a really bad muscle tear with a lot of swelling and things, you may want to keep it still for a little bit longer. But again, guidance from a healthcare professional would be useful in that circumstance. So your other question was, when can you start training after an injury? Now, again, I'm going to give you a bit of a fluffy answer because it all depends on what type of injury it is and what type of training you want to do. So you guys should know by now that I believe in relative rest, that you don't have to rest fully. You just cut out the things that aggravates that injury. So for instance, I had somebody today with a sprained back, muscles in her back that's been sprained, and the movement that really aggravates it is going forwards in that position because she did it on the rower and going to the side. But she's okay walking and she's okay cycling. So, and she actually feels better if she do those things. So she can do anything that she can do pain-free. If you have injured, like let's take a biceps muscle for instance. If I've pulled my bicep muscle, I first want to be able to get pain-free range of movement without any weight. Once I can do that, then you want to start adding little bits of weight. But to be honest, at the beginning, it's going to be so little that you're nearly embarrassed to let anybody see it. So it's better doing it just with your water bottle. And as that becomes pain-free, then you can add more and more weight as you go. But the big thing is always start lighter than what you think you want to do. Wait for the 24-hour response because often it feels okay while you're doing it, but 24 hours later, like the next morning you wake up and you go, oh, that's really sore today, then it means you've likely overdone it. So just don't try training that body part if you haven't got the full range of movement pain-free first. And once you've achieved that, then you can start thinking of adding a little bit of weight onto it, but always just err on the side of caution. Good. That's it. So, hello Angelique, I'm glad you could join us. Let me know if you guys have any questions. As always, I'll answer them in the comments below. And yeah, that's it. Also, I'm starting to think of topics for the next series of live streams. So let me know if you've got any specific things you want me to talk about, and I can get those in there for you as well. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.